So we've got your health history done, we got your home's health history done, we've made some recommendations for binders, we've explained how we're going to do shipping processes. What's the next thing we do? Inevitably, blood sugar. And this might be something that's new for a lot of you who have gone through CIRS treatment before. But honestly, this piece is, I would argue, essential for every single CIRS patient. I don't know off the top of my head exactly how many patients have dysregulated blood sugar, but it is almost all of them. Almost all of them. So what we do with our patients is we use Freestyle Libre. They're called the continuous blood sugar monitor. So if you've ever seen somebody with like a loony-sized plastic circle on the back of their arm, on their tricep there, so what it does is it monitors your blood sugar continuously. Each device gives us 2 weeks of data, and assuming all goes well, we should have that data monitored 24/7. So we know what it's doing when you're sleeping, when you're getting up in the morning, what happens after you eat breakfast, what happens after you eat lunch, what happens when you're fasting. Most CIRS patients have severely dysregulated blood sugar. In some of them, you'll see very high levels of blood sugar. On others, you'll see very low levels of blood sugar. But the majority, it's a dysregulation. So we see blood sugar go up really quite high after eating, and then within half an hour we see it crash back down to pre-meal levels. And it's this intense up-down pattern in one's blood glucose that is going to drive one's emotions to unwanted territories, be feeling quite down, quite depressed with these big swings in your blood sugar, and more importantly, or as importantly, your energy levels. So if you see your blood sugar doing this throughout the day, this is what your energy levels are also going to be doing. Those moments when you're kind of like in a catatonic state of fatigue might be driven, at least in part, by your blood glucose. And it's something that is not very commonly looked at in the CIRS treatment community. And it's my recommendation that we should, as practitioners, be doing this for every single CIRS patient. This is way more than just a finger prick blood sugar reading. We want a continuous blood sugar reading done 24/7, ideally for 2 weeks. And I would be surprised if you do not pick up some pretty gross anomalies on your blood sugar. And what this can help you do is to create a personalized or customized diet. So when I first started my career, I was very much pro-paleo, 100% in the paleo camp. Things progress, I moved more towards the keto camp, and I was very much like pro-keto, and that is the best diet out there. As I started experimenting and doing these blood sugar experiments with patients, I quickly learned that I'm quite camp agnostic at this time, and really it's going to be based on the individual. And it's far more complicated and intricate than just as something as like Twinkies are bad and sweet potatoes are good. You will be amazed at how your individual blood sugar responds to certain foods. Certain healthy foods might actually be incredibly detrimental to your health or your blood sugar. So altering and creating a personalized or customized diet is one of the first things that we do in treating CIRS. And sometimes it's just as simple as changing the order in which you eat your food. So eating your greens before you eat your carbohydrates. Just doing that one tweak alone can be more than enough to help stabilize your blood sugar. So just because you're hearing me talk about dietary changes, it's not often massive dietary overhauls. And as far as most of you would know who have CIRS, you're well aware that CIRS is not a dietary illness. So that's not to say that diet isn't important. It absolutely is, but it's not going to solve for the illness. So you could go keto, carnivore, paleo, SCD, vegan, doesn't particularly matter. It's not going to create or solve, create a solution for your CIRS. It might help to better manage your symptoms, but it's not a long-term solution. And so my general recommendation going forward in the context of diet is create a personalized way of eating that balances your blood sugar. Once you figure out your blood sugar, you'll be amazed at the progress you make. Just that one thing of balancing your blood sugar can bring about significant stabilization in your symptoms. And in the first stage of CIRS treatments, that's all that we're going for. We're not promising massive improvements in energy or massive improvements in pain or any symptoms. What I'm always looking for as a clinician in the first quarter of treatment, so the first few months that we're treating things, if we can get a stabilization in symptoms. And what I mean by that is your tomorrow is going to be a lot similar, very similar to what your today is like, so that you can know, like, all right, this is what my energy level is going to be consistently on Monday, Tuesday, Wednesday. that makes planning your life so much easier. Generally, when we first start treatment with CIRS patients, their symptoms are all over the place, up and down. Some days better, other days they're bedbound and can't leave the bedroom for the entirety of the day. By balancing your blood sugar, it really becomes this essential foundational piece in the CIRS treatment cascade to just give you that kind of stable level of energy. And that's a perfect foundation for which we build the rest of the CIRS treatment plan off of.